There's a question of pain management, interventions. There's a question related to symptom management. There's 2 questions on communication. Grief. Assessment. Grief, there's 4 questions. Assessment, nursing diagnosis, interventions, and something related to diversity.
Are you going to put the thing online where you did the...
No. Legal and ethics, there's 5 questions. 1 on assessment, 4 on interventions. Physiologic, there's an intervention question. Spirituality, there's an assessment question. Postmortem, there's a question on interventions and a question on diversity. There's a question on assessment of signs of death.
Hold on 1 second.
Oops, okay.
I'm on physiology.
I'm in physiology.
Physiology, there's an intervention question. Spirituality, there's an assessment question. Postmortem, intervention and diversity question. 2 questions.
Intervention and what was that?
Diversity.
Signs of death, an assessment question. Language barrier, an intervention question. While I'm at it, spirituality, which was a little before. Spirituality is a concept, there's a question. So I have to go back to your slide and see where spirituality is a concept, what I'm talking about. Spirituality related to health and illness. There's 3 questions. 2 on assessment and 1 on interventions. The role of the nurse in spirituality, a nursing diagnosis question. There's 3 intervention questions.
The role of what?
The nurse. Three interventions and a nursing diagnosis. There's a question on faith as a concept. There's a question of quality measures. And 2 questions on spirituality conflicts. While I'm at it, I'm going to tell you the cancer and sleep stuff too, and then I won't do it on here. Sleep. There's a question related to pathophys of sleep. Assessment question on stages of sleep. Assessment question on age variations. Intervention related to exercise and sleep. Questions on promoting sleep, mainly related to nursing interventions, 1 about a nursing diagnosis. There's a question about narcolepsy. A question about assessing sleep disturbances. Question about nursing interventions for benzodiazepines. An assessment question on chloral hydrate. Intervention question on insomnia. And an assessment question on herbal therapy used to promote sleep. And finally, cancer. cancer, I'm to talk about some terms associated with cancer, risk factors, I don't talk about different diseases at all. It is just an introduction. As far as all the different types of cancers, those are talked about in, like GI cancers in the GI class, respiratory in the respiratory class. So cancer. Related to terms, classifications of cancer. Then there's interventions to prevent cancer. Lifestyle risk factors. A term question related to cancer characteristics.
What was that?
Repeat that, please.
A terms question on cancer characteristics. Cancer. They never die. They don't. It keeps growing despite invading other tissues. There's all these different things comparing cancer to normal cells. There's a question about metastasis. There's two questions related to benign versus malignant, differentiating between them. Question about warning signs. About biopsies. About cancer rates. I don't know what that would be right now.
Cancer rates.
Rates, R-A-T-E-S. And tumor names. I'm thinking what that cancer rate one would be, because I don't usually have statistics, so I'm not sure. I'm going to end the sermon today. Thank you for bearing with me.